Okay, today we'll study the BMS third phase research methodology subjects, second chapter, historical development of contemporary research in Ayurveda. Okay, how the research is grown in from the history that we'll study in today's class. Okay, this is the first topic in the chapter, second in the research methodology. Okay, now we will study in the 6 steps. The first step is that ancient period. The ancient period is up to 18th century AD, that is the 18,000 AD. Here we can see that how the Ayurveda is originated. The Ayurveda is originated mainly from the Vedas. Okay, Vedas, especially from the Atharvaveda, the Ayurveda is originated. Okay, now the main rule is the classical treatise like the Charaka Samhita, Sushruta Samhita, and Ashtanga Sangraha. These are the they are foundations of the Ayurveda. Okay, and the research methodology was based on mainly the Pratyaksha, Anumana, Aptopadesha, Yuktis. These are the 4 tools that we are using for the any research. Okay, for the purpose of any research, these are the 4 tools we are using in the research. Okay, this is about the ancient period. You can see these are the developments. Next one is the colonial period, that is the British rule. In that we can see that from the 1800 to the 1947 up to independence, we can see that Ayurveda practice is declined due to the British rule. The British is mainly concentrating to the develop in the modern medicines only. Okay, they are declined. They are not at all help for the any clinical research or Ayurvedic. They are not supporting to the Ayurveda research. But however, we can see that individual effort continued in the documentation of the Ayurveda. Okay, the individual persons in the history, we can found that the Pandit Madan Mohan Malaviya as well as the Raja Serfoji Thanjavur. Okay, these peoples they are documented the Ayurvedic works. And here not only the documented, here they did the initial steps for the taken for the establishment of college as well as the Sanskrit schools. Okay, this is up to the colonial period. Now after that, the post-independence, Ayurveda now officially recognized as one of the Indian healthcare systems. Okay, after independence, now Ayurveda is considered it is one of the branch of the Indian healthcare systems. This is recognized after independence, 1947. Now after that, the Boer committee is supported for Indian systems. Okay, they told that government of India should support the Indian medical systems. Okay, this is the Boer committee recommendation. Now after that, the 1969, the CCRAS is established. Okay, that is Central Council for Research Indian Medicines and Homeopathy was established to organize the scientific research. For the scientific research purpose, this is the established, that is the CCRAS is established. Okay, the next one is the establishment of CCRAS, that is the Central Council of Research Ayurvedic Systems, that is the CCRAS 1978, that is established. CCRAS is established. This is the main what is called as one of the main stone here. From that, the research in the Ayurveda is did the very fast. Okay, that is from the 1978. It is CCRAS mainly focus in the areas that is the drug standardization and quality control, preclinical, clinical research is the main they are focusing. The CCRAS organization focusing. Other than that, is the tribal medicines documentation, that is the folklore medicines, they are also documented CCRAS. Next is the development of Ayush research councils, that like research institute like Rari, Kari and Narip were developed. Okay, this develop Ayush research councils. Here the separate here CCRAS, they are given the responsibility to some institute. Okay, like the Rari, that is a regional Ayurvedic research institute, central Ayurvedic research institutes. They are taken the responsibility under the guidance of CCRAS, that is the separate institute. They are conducted the different research. Okay, in the 1978. After that, now in the modern era, after 2000 AD, you can see that the creation of ministry in the under the Modi government, that is the 2014, the separate ministry was established. Here, after that, in the 1917, All India Institute of Ayurveda established in 2017. Okay, the rule is that the standardized institution they are planning to do. Okay, the next one, integration of the modern tools. Okay, what they did after the 2000 or modern period, that is the CCRS. Under the CCRS, the separate modern tools they are integrated. The modern institutions or the modern research scholars, what they are using while they after the post market, their pharmacovigilance is they are observing that whether there is adverse effect or that is the pharmacovigilance they are using for the any adverse effect in the research. Now after that, the Ayurvedic research scholars are also the CCRS also start the using the modern tools like pharmacovigilance and bioinformatics. These tools also the Ayurveda started the following. The next one, launch different that is the what is called tools, that is Ayurveda Net, TKDL, e-research and international collaboration with WHO and MOS. What happened here? Ayurveda here CCRS launched the AyurNet, TKDL, that is a traditional knowledge digital library and e-research portal the CCRS launched for the benefits of the research. Okay, now after that the government of India as well as the CCRS Ayush Ministry, they are international collaboration with WHO and MOS. Okay, for the growth of the Ayurveda, they are international collaboration with the WHO. Okay, now the current initiatives. At present, what is the research initiatives going on that we'll discuss. The first is the research on COVID. At present time, the research on the COVID-19 and non-contaminated disease, mental health care, women health care under CCRS. These are the initiatives. These are the research are going on nowadays. Okay, under the CCRS. Next one is the promotion of Ayurveda biology and digital Ayurveda. Okay, the government is what they are doing, the promotion of Ayurveda biology. Okay, Ayurveda biology and digital Ayurveda they are launched for the research. Okay, in the field of that is the research. Now the launch of program likes, now Government of India Ayush Mantralaya launched the programs like Ayurveda smart guidelines for clinical trial for the convenience easy for the Ayurvedic research. Now the conclusion is that, okay, after that all that, the conclusion is that the research is in the Ayurveda started from the Ayurveda evolved from the traditional methods as well as from the paramparic methods or through the what we call Anubhav Adharita. Now it is converted into that is evidence-based scientific approach. Okay, when the research is started, the research is when they started in the ancient period, that time research is mainly they are focusing on the experience, based on the experience, empirical based on the empirical knowledge or based on their what is called traditional knowledge, based on their clinical experience, the research is started. Now the research at present era, the research is mainly evidence based. Okay, Ayurveda is focusing mainly on Ayurveda evidence based and scientific approach. Okay, this is about the historical development of contemporary research in Ayurveda. Okay, if you like this video, please subscribe, share and like. Thank you.